that establishes that these cuts are being discussed.
I said that I have made clear we will not be cutting frontline health care. If they're
But
working
your
on
subordinates are discussing this. They must have gotten the directions from somebody. Why did your team request this analysis, and what are you preparing for? Veterans in Congress can examine it before it's put into force. 83,000 is a lot of people to cut.
We're going to provide everything we're supposed to under RIF to make sure you have every notification you have. So as we look at this, Mr. Chairman, I appreciate you allowing me the time. I appreciate the ranking member. I appreciate all the committee wanting to do good work. But what I can't have is spending another 100 days as we go forward here, because as Dr. Morrison and many others say, yes, there is from people who have morale issues because they're having to sit here and listen through wrong answers.
VA Secretary Denis McDonough faces tough questions about leaked documents showing plans to cut thousands of frontline healthcare jobs, despite his public claims to the contrary. Lawmakers demand answers on transparency, hiring freezes, and why veterans and VA staff are being left in the dark. Is this reform or a threat to veteran care?
Ranking member.
Thank you, Mr. Chairman. Thank you, Mr. Secretary, for being here today. Mr. Secretary, you've testified that, quote, no one has discussed firing doctors or firing nurses, end quote. No one has discussed this. And that the 15% figure floating around is just a goal, not a directive. Then I need you to explain this spreadsheet that I have behind me. And we're handing you a copy of this spreadsheet. It was circulated by your own reorganization implementation cell. It asks VA staff to calculate the savings from a 15% cut to every VHA position, including frontline clinical roles. And it says cutting nearly 4,000 nurses, for example, would save $1 billion. Cutting 400 psychologists, another $110 million. The list goes on: health aides, pharmacists, housekeepers, etc. Now, if your testimony is true, that no one is looking at plans to cut these jobs, why did your team ask for this analysis?
Ranking member, I'm looking at this right here. This is exactly why we're here. This is a leaked pre-decisional document that is not helpful, and it is not working, because here's the end of the day. I'm going to answer this.
Claiming my time, Mr. Secretary. It's my time.
Well, it's my answer.
You have said publicly that no one has discussed, that would be interpreted, no one has discussed this at all. But we have a document, whether leaked or not, that establishes that these cuts are being discussed.
I said that I have made clear we will not be cutting frontline health care. If they're
But
working
your subordinates are discussing this. They must have gotten the directions from somebody.
They did. Well, I've been very public. It's just like your staff. If they want
Okay,
to talk about something
you can
that you don't know
understand
about.
why there's a lack of credibility from the public on this sort of
There's
stuff.
a lack of
This is not
credibility for
speculation, Mr. Secretary. It is a VA document. We have asked your head of HR, Mark Engelbaum, for answers. We've actually asked your subordinates about this. He promised a follow-up, and we never got it. So I'm asking you now, on the record, why did your team request this analysis, and what are you preparing for?
Well, if I have to explain this in a way that makes sense, let me just say this. If you
Don't
look
talk
at
down to me, sir.
if you
I'm
look
just
at
asking you a question.
I'm just answering your question. If you let me answer it, I'll answer it.
Please, time is ticking.
This right here is an overlook of our entire organization to see. What they did here is fine. Whatever they're looking at is fine. But when it comes to the Secretary of VA, which is me, and the direction that we have given to make sure that health care is prioritized, to make sure that our veterans are getting the desire that they need. And when I've told you that when we're talking about this and exempted 300,000 positions, that is what happens at the VA.
Okay,
Can they have other conversations that involve other things? Possibly so. But coming from me, it's not.
Okay, well, thank you. Let's move on. So I'd like to point out that you've set a goal of 83,000 VA employees. I know it's not a fact, it's a goal, but I just want to make sure we go over this and we have some agreement without cutting clinical staff. There simply aren't 83,000 employees elsewhere in the department. If you look at this chart over here, you've already cited these numbers yourself.
Yes.
So if we add up all the VBA, NCA, and all the other positions, it hardly adds up to 83,000. You're going to have to cut deeply out of the VHA column there. So, there's just simply no way that that can be done without that. So I would also like to move on and say it is also our understanding that on the VA Human Resources SharePoint, there is a document that lists every employee hired since 2019 with their name and occupation. Will you get that document to us in digital form?
I'm not familiar with the document you're talking about.
But if it does exist, I mean, we know it exists. Would you get it to us? It's
I
a
don't know
simple
what
document.
you're talking about. And also, if I can answer your other question, it would
Okay,
be-
no, I'd like to move on. I want to move on to the, I'd like to move on to the Deferred Resignation Program. There's been a lot of confusion about the Deferred Resignation Program.
Okay.
It is my understanding that you have made employees who are in positions that provide direct care exempt from this program unless there is an additional review by VA leadership. How many employees who directly provide care or support the provision of direct care have submitted requests for DRP, early retirement, or retirement?
The last number I had on that was about 2,500. About 2,500, of which all of them will be probably, all of them are going to be denied.
You're going to deny them. So you're telling me today that you're going to deny all of the clinicians who've applied for DRP.
That is what we're looking to do. And I will say this, as we look at this, one of the issues of DRP is making sure that employees who want to be here or not, we're not looking to get rid of any clinicians. We're not looking to get anybody. In fact, we're turning
That's
it down.
fine, I got it, but 2,500 clinicians have applied for DRP. You're going to deny those.
We're denying clinicians.
You're
That's
denying.
been
But have you thought about why frontline staff are requesting DRP in the first place? To me, it's an indictment of your leadership that valuable clinicians that are hard to recruit, hard to onboard, that staff who loved serving veterans now want to leave.
Well, have you looked at actually the ones who may want to leave and how close they are to retirement to start with? Have you actually looked at where they may be? I've not looked at those, but we're going to keep them in the system. So your question may sound, like it's ominous, but also you've not answered the other question, who these people actually are.
Okay, well, so fine, let's move on. Mr. Secretary, are medical center directors exempt from the hiring freeze? Medical center directors.
Yes.
They are. So to be clear, so
They're
is
part
that
of
your
our,
answer?
they're part of the clinician side, yes.
Okay. Well, to be clear, the list you have provided to Congress does not include medical center directors as exempt positions. That is not.
It's been updated.
So now it is. Now, according to a report that VA just submitted to Congress last week, there are 12 medical center director vacancies, 8 of which cannot be hired due to the freeze. The chart behind me shows a page from the report with those vacancies listed and the status, which is that, quote, recruitment is on hold due to hiring freeze, end quote.
We're working to fill all those. When we find those, we're working to get them hired. Many of those were actually predecessor to me.
All right, well, this document shows that they're empty because of a freeze. So you'll commit to exempting medical center directors from the hiring freeze and prioritize finding leaders for those facilities as soon as possible?
Already have.
Wonderful. Well, Mr. Secretary, I just want to know, can we get a RIF plan before you execute it and not execute it for 30 days so that the public, veterans, and Congress can examine it before it's put into force? 83,000 is a lot of people to cut.
We're going to provide everything we're supposed to under RIF to make sure you have every notification you have.
Well, that's not the same as providing us with the draft plan so that we all can discuss it together. That's 83,000 is a huge change.
And again, I wasn't able to answer your question because you didn't allow me to discuss the 83,000.
Well, I'll take that as non-responsive.
I'll take yours as not letting me answer.
The gentleman yields back. So one thing I've discovered about today is that normally the ranking member and myself, we ask our questions first. So what has happened is I think we have questioned you to the point that I think we got a lot of answers of what my questions were going to be. So maybe I'm going to ask you this. What is something that has not been asked that you feel is vitally important to put on the record?
Mr. Chairman, I think it's not what necessarily has been asked, but I think it is from the perspective of how it was asked. And this is the fight that you and I have spoken about, and I've spoken to many, and we just got through with it. And please hear me to everyone here. I consider the ranking member a friend. We came in. We vehemently disagree on this because I think the problem we have here is something that I refuse to talk about in a setting like this, or where we actually have living proof of pre-decisional documents being leaked at basically even against the law of the land, that these are not supposed to be leaked. We see this. If they want to go to Inspector General, whistleblower, those are all there for them. But this is the exact reason I was asked earlier about NDAs. Okay, because now what is happening, as you sit here and we put up forms, we're continuing to fester this idea that there's no way we can do what needs to be done without hurting veteran health care. I refuse to accept that. Because one thing that was not accepted, and I was not able to continue, there are 409 positions in VHA. And when we look at that and you look at some of the areas that we have in VHA, which also includes call centers, which also includes staffing issues, they also include procurement, they also include HR, they also include processing of payroll, which these hospitals were not supposed to be doing. By the way, those numbers add up to significant amounts. What was not said just a minute ago is that just last year, the Biden VA in the VHA in their own internal documents stated that they could get rid of 28,000 people. This is the Biden VA 6 months ago. Haven't heard that. 28,000. Now, if you go by the numbers that I've been told today, oh, you can't do that without hurting health care, then we're saying the Biden administration wanted to hurt health care. No, I think they actually looked at the same numbers we did, Mr. Chairman, and determined that of the frontline healthcare, frontline disability workers and all, there is a lot of interest in looking at are we being as efficient as we should be. And I believe that as we look at this, you're going to find those answers, and that is why we have to do this in a very methodical way. Everybody wants to run forward and say, here, give me your plan, because you know what? Then they want to go out and say, you're going to cut here, you're going to cut here, and they're going to put fear in my employees, and they're going to put fear in my veterans. That's wrong. It's wrong. You see no other industry in this country who are making decisions about their workforce who do it in a way that we're talking about being told here. We're doing it in a methodical way, using career employees who've been there forever. We're actually looking at using consultants. We're actually using our political folks to get this into the record to say, here's how we look at this. Looking at the examples of private industry and knowing that we're not private industry, we're a veterans organization that gets to treat the best people in the world, and that is our veterans. We only have one mission, the veteran. But over time, we have gotten away from that. So when you look at these numbers, I have a question for anybody that wants to look at this. Why do we have a middle management, if you would, or a structure system that keeps our clinicians out from seeing patients? And then saying that if we look at anything of a doctor or a nurse who's not seeing patients, that we're going to affect health care if for some reason they wasn't around or if they quit on their own. I think what we're saying here is there's a large understanding gap that unfortunately has become political. I could go along almost every member except the new ones, because there's a lot of new on this committee, Mr. Chairman, and I can go from ranking member to you to everybody else and find quotes on the Senate side as well. VA needs reform, VA needs efficiencies, VA needs cost cutting, VA needs all these things, both Democrat and Republican. And then all of a sudden, you have somebody like myself who is just, and I say this in knowing that somebody will use it against me, I'm just a simple country lawyer from North Georgia who simply says, maybe we actually ought to look at this. And maybe we actually ought to ask the questions on why we have this. And why do the VSOs and why do others always seem to have issues that they want to get fixed at the VA, but all we do is continue to perpetuate the problem? I'm not willing to do that anymore. We can disagree. The president told me to do one thing, and that's take care of our veterans. And yet, in this time frame, which was not brought up, and we're going to bring it up even again, by the Biden administration, they changed the wait time issue to make it more transparent so that we, in fact, I got this last week when I said the primary care days. Let me just repeat this. It's worth repeating. Primary care rose from 15.7 to 24.3. Mental health rose from 14.7 to 20.4. 24 days for specialty care rose to 38. And the backlog, by the way, interestingly enough, in 2019, before the COVID, was under 60,000 on the backlog. Of course, it went up during COVID because we couldn't get our appointments. And it is still at 260,000 when I came in. In less than 100 days, we've actually brought that down 21% to 200,000, and it's heading south. Now, I was actually accused the other day of, well, you're using flawed numbers, and the VA wait time's flawed because the VA changed the way it does its wait times. But here's the problem. It was changed under the Biden administration to better reflect calculations because the data reinforced above did not reflect the adjusted change. It plainly shows that the wait times increased because here's what you need to hear. Wait time clock started only after a veteran was contacted by a scheduler for appointment under the prior administration. In other words, we didn't even start the clock till we reached out to them. The veteran may be looking to get their help, but they didn't get it. So the new method, which was again done under the previous administration and adjusted through every number beforehand. So there's no apples to oranges here. This came from Dr. Lieberman, who is our top doctor, by the way, at the VHA. The method is now calculated on when the schedulers are called to reduce so that we actually make a queer time. So as we look at this, Mr. Chairman, I appreciate you allowing me the time. I appreciate the ranking member. I appreciate all the committee wanting to do good work. But what I can't have is spending another 100 days as we go forward here, because as Dr. Morrison and many others say, yes, there is from people who have morale issues, because they're having to sit here and listen through wrong answers. Out of that yield.
Yes, I do. Thank you. Mr. Secretary, you know, you're opining about a so-called leaked document. It's obvious. It's obvious. We're not mushrooms. We're going to hear stuff. We're going to hear stuff from employees who are alarmed about huge, massive changes that are occurring. And that document, when we don't get answers to our questions, when there's no transparency, we're going to rely on whistleblowers telling us the truth. Look, private industry, sir, would not have fired 2,400 employees and then hired back 1,000. That was indiscriminate firing of probationary employees. A memo went out, signed by Tracy Therrett, that said they were being fired because of their performance. And I questioned her, and she couldn't really cop to the fact that they were fired because of their performance. And I'm not even sure really that you personally authorized all of that, or whether it was someone from the Office of Personnel Management. And she in fact said that memo was actually not, even though she signed it, was actually not written by her, but was written by OPM, which does not seem like it came from the Secretary's office. And that, sir, was entered into evidence into a federal court. And that judge did indeed rule that they had to be restored, those probationary employees. That 28,000 employee cut that you were talking about from the Biden administration of VHA, you know, is related not due to necessity, but because of a shortfall in the budget. And there was a huge shift in acceleration of expense in the community care account. So, you know, we need to have some space for some straight talk here, and we're not getting it here. Now, Mr. Secretary, I must say I was pleased to hear you say that you want to make the disability claims process easier to veterans. I was listening carefully to your response. I personally do not want to see claim sharks legitimized. And I'm not saying you're taking a side on that gentleman's bill, but I think we have some meeting of the mind here. We do need to, maybe we need to talk about some presumptives that would make the process easier and more veterans would get through that red tape. I'm all for cutting that bureaucratic red tape, and so we share that goal. We do need to make it simpler for veterans to get care and benefits. And there are two really good ways to do that. One is to increase the number of presumptive illnesses, and the other is to automatically enroll transitioning service members into VA healthcare, as my legislation in the eVest Act does. And I look forward to your considering supporting that bill and to VA increasing the number of presumptions of service connection. I also think it is possible for us to work together and help veterans and ensure that VA is a world-class institution. But I cannot emphasize enough that VA's unresponsiveness to my questions and letters is not acceptable. VA's recent habit of canceling long-standing briefings at the last minute is also not acceptable. VA's refusal to provide briefing materials to staff is not acceptable. And we cannot have a productive relationship if we do not have the information we need for our constitutional oversight responsibilities. Now, when you told Ranking Member Ramirez that canceling outreach was not your intended policy, I take you at face value. So I expect that our follow-up questions about this outreach problem will receive responses with the same candor and attention. This outreach issue is not limited to just one district or facility. Now, you blame the issue on quote-unquote malicious compliance. But sir, the buck does stop with you. And I know that's a phrase that you embrace. If policy is not being implemented correctly, then I say it is on you. If veterans and employees are scared and feel like they have to over-comply with a policy, that's on you. That should cause you to re-examine the policy as well, not just blame the staff. If you truly want to lead VA, accountability is where leadership begins, and you cannot expect your employees to be accountable if you will not be yourself. Now, another thing I just want to say is I've gotten concerns from my colleagues about this directive that any member of Congress wanting to visit their VA facility has to get it cleared through your chief of staff. And they're having to take that very literally. They're taking it very literally, based on all that we're seeing coming out of your first 100 days or so in office. That cannot stand. Members of Congress need to be able to visit their facilities, talk to their medical center directors, and be able to see what's going on. My job as an elected official and the ranking member of this committee is to represent the interest of veterans. We cannot answer questions from veterans or get them information if we cannot get answers from VA. We cannot represent veteran interests if we do not have the full picture of how their interests will be affected, and that is why veterans are scared. Now let me be clear, veterans are not scared because I or any other member of Congress asks a question. They are scared because you have made massive changes with no plan, no details, no accountability, and no transparency. If you truly believe it is quote-unquote fear-mongering to ask a question, then you should ask yourself why you, Mr. Secretary, fear answering our questions. Now, I am proud of the employees who have bravely shared their stories with us. We are relying on the courage of whistleblowers now more than ever. I'm grateful to the veterans who have shared their concerns, and I will continue to fight to ensure that their worries are heard and addressed. Now, Mr. Secretary, if you want to accuse VA employees of quote-unquote malicious compliance, I say you need to examine your role in creating a culture where VA employees feel like your directives to require them to implement policies that harm veterans. Reconsider the cruelty in your treatment of minority veterans. Reconsider your termination of collective bargaining rights for the hardworking public servants. Reconsider your role in ending critical programs like VASP, because veterans will now lose their homes to foreclosure unless you put a moratorium on those foreclosures until we can ramp up the partial claims legislation. Reconsider your pause of clinical trials, leaving sick veterans without the lifeline of hope. Reconsider how you have indiscriminately fired employees only to hire them back again. So, Mr. Secretary, I truly hope that you'll go back to the central office today and chart a plan to course correct. That plan should include complete and truthful answers to all of the questions you were unable to answer today, and a path to true partnership with both sides of this committee. And with that, I yield back.